Alopecia. Alopecia is a medical term used to describe hair loss or baldness. This condition affects both men and women and can occur at any age. Alopecia can be caused by a variety of factors including genetics, autoimmune diseases, hormonal imbalances, nutritional deficiencies, and certain medications. There are several different types of alopecia, each with its own specific causes and symptoms. Some of the most common types of alopecia include 1. Androgenetic alopecia. This is the most common form of hair loss and is caused by a combination of genetic and hormonal factors. In men, it is often referred to as male pattern baldness, while in women it is referred to as female pattern baldness. It typically starts with a receding hairline or thinning at the crown of the head. 2. Alopecia areata. This is an autoimmune disorder that causes hair loss in patches on the scalp and other areas of the body. The immune system attacks the hair follicles, causing them to shrink and stop producing hair. 3. Telogen effluvium. This type of hair loss is caused by a disruption in the normal growth cycle of hair. It can be triggered by stress, hormonal changes, or certain medications, and usually results in a diffuse thinning of the hair. 4. Traction alopecia. This type of hair loss is caused by damage to the hair follicles from repeated pulling or tension. It is often seen in people who wear tight hairstyles like braids, weaves, or ponytails. 5. Trichotillomania. This is a psychological disorder in which people compulsively pull out their hair, resulting in patchy hair loss. The symptoms of alopecia can vary depending on the type of hair loss. In some cases, it may be gradual and unnoticeable, while in others it can happen suddenly and result in significant hair loss. Some common symptoms of alopecia include hair loss on the scalp, eyebrows, eyelashes, and other areas of the body. 1. Thinning of the hair or bald patches. 2. Itching or burning of the scalp. 3. Tenderness or pain in the scalp. 4. Changes in the texture or quality of the hair. Diagnosis of alopecia usually involves a physical examination of the scalp and a review of the patient's medical history. In some cases, a doctor may perform a scalp biopsy or blood tests to determine the underlying cause of the hair loss. 1. Alopecia areata is an autoimmune disorder that affects hair follicles, resulting in hair loss on the scalp and other areas of the body. It can occur at any age and affects both men and women. There are several subtypes of alopecia areata, each with its own unique presentation and progression. Areata. Alopecia areata is the most common type of this group, characterized by round or oval patches of hair loss on the scalp or other parts of the body. The affected area may be smooth or have a slightly raised or bumpy texture. The patches may merge and spread, resulting in larger areas of hair loss. Alopecia areata does not typically cause scarring of the scalp. 2. Alopecia areata totalis. This subtype of alopecia areata results in total hair loss on the scalp. It may also affect facial and body hair. Unlike alopecia areata, which usually presents as patchy hair loss, alopecia areata totalis results in complete baldness on the scalp. 3. Alopecia areata universalis. This is the most severe form of alopecia areata, resulting in complete hair loss on the scalp and body, including eyebrows and eyelashes. It is a rare condition that affects only a small percentage of people with alopecia areata. 4. Diffuse alopecia areata. This type of alopecia areata presents as a more widespread, diffuse thinning of the hair on the scalp, rather than distinct patches of hair loss. The hair may appear thinner or sparser all over the scalp, rather than in one specific area. 5. Aphiasis alopecia areata. This subtype of alopecia areata presents as hair loss in a band-like pattern around the sides and back of the scalp, similar to a wave or U-shape. It can be particularly difficult to treat and may result in permanent hair loss. The exact cause of alopecia areata is not fully understood, but it is thought to be an autoimmune disorder in which the body's immune system mistakenly attacks hair follicles. Factors that may trigger the onset of alopecia areata include genetic susceptibility, environmental factors, stress, and certain medications. What are the risk factors for a patient to suffer from alopecia? The exact cause of alopecia areata is not fully understood, but there are several risk factors that may increase a person's likelihood of developing the condition. These include 1. Genetics. Alopecia areata often runs in families, suggesting a genetic predisposition to the condition. 2. Autoimmune disorders. People with other autoimmune disorders, such as rheumatoid arthritis or lupus, may be at an increased risk of developing alopecia areata. 3. Age. While alopecia areata can occur at any age, it is most commonly diagnosed in people under the age of 30. 4. Gender. Alopecia areata affects both men and women equally, but the condition may be more severe in men. 5. Stress. Emotional or physical stress may trigger the onset or exacerbation of alopecia areata. 6. Environmental factors. Exposure to certain environmental factors, such as viruses or toxins, may trigger an autoimmune response that leads to hair loss. 7. Medications. Certain medications, such as those used for cancer or autoimmune disorders, may increase the risk of developing alopecia areata. 8. There are certain medical conditions that may be associated with an increased risk of developing alopecia areata. However, it's important to note that having a family history of these conditions does not necessarily mean that a person will develop alopecia areata. And many people with alopecia do not have a family history of these conditions. Here is some information on the association between these conditions and alopecia areata. Asthma. While there is no clear link between asthma and alopecia areata, some studies have suggested that people with asthma may have an increased risk of developing autoimmune disorders like alopecia areata. Down syndrome. People with Down syndrome have an increased risk of developing autoimmune disorders, including alopecia areata. 10. Pernicious anemia. Pernicious anemia is an autoimmune disorder that affects the absorption of vitamin B12. While there is no clear link between pernicious anemia and alopecia areata, some studies have suggested that people with pernicious anemia may be at an increased risk of developing autoimmune disorders. 11. Seasonal allergies. While there is no clear link between seasonal allergies and alopecia areata, some studies have suggested that people with allergies may be at an increased risk of developing autoimmune disorders. 12. Thyroid disease. People with autoimmune thyroid disease, such as Hashimoto's thyroiditis or Graves' disease, have an increased risk of developing autoimmune disorders like alopecia areata. 13. Vitiligo. Vitiligo is an autoimmune disorder that causes loss of skin pigmentation. Like alopecia areata, it is thought to be caused by an autoimmune response. People with vitiligo may have an increased risk of developing other autoimmune disorders, including alopecia areata. It's important to note that having one or more of these risk factors does not necessarily mean that a person will develop alopecia areata. And many people with the condition have no known risk factors. If you are experiencing hair loss or other symptoms, it's important to talk to your doctor to determine the underlying cause and appropriate treatment. Treatment of androgenetic alopecia. Androgenetic alopecia, also known as male or female pattern baldness, can be treated with medications. There are several medications available that are FDA approved for treating androgenetic alopecia. One of the most commonly used medications for treating androgenetic alopecia is finasteride, which is a prescription medication that works by blocking the conversion of testosterone to dihydrotestosterone, DHT. DHT is the hormone that is responsible for shrinking hair follicles, leading to hair loss. Another medication that is commonly used for treating androgenetic alopecia is minoxidil, which is available over the counter. Minoxidil works by increasing blood flow to the hair follicles and promoting hair growth. In addition to these medications, some doctors may also recommend using ketoconazole shampoo or low-level laser therapy as a complementary treatment for androgenetic alopecia. It is important to note that not all individuals with androgenetic alopecia will respond to medication, and results may vary depending on the individual. It is also important to talk to a doctor before starting any medication for hair loss to ensure that it is safe and appropriate for you. Treatment for alopecia areata depends on the severity and extent of the hair loss, as well as the patient's age and overall health. In some cases, hair may regrow on its own without any treatment, while in other cases, treatment may be necessary to stimulate hair growth and prevent further hair loss. Some common treatments for alopecia areata include topical corticosteroids, These are anti-inflammatory medications that can be applied directly to the affected areas of the scalp to reduce inflammation and promote hair growth. Topical minoxidil, this medication is used to stimulate hair growth and is applied directly to the scalp. Systemic corticosteroids. In severe cases of alopecia areata, oral or injectable corticosteroids may be used to reduce inflammation and promote hair growth. Immunosuppressant medications, these medications are used to suppress the immune system and prevent it from attacking hair follicles. There is a type of immunotherapy that can be used to treat alopecia areata, a condition that causes hair loss in patches. This type of immunotherapy is called topical immunotherapy, and it involves the application of a chemical called diphencyprone, DPCP, or squaric acid dibutylester, SADB, to the scalp. When DPCP or SADB is applied to the scalp, it causes an allergic reaction that triggers the immune system to attack the hair follicles, which may stimulate hair growth in some people. This treatment is typically administered once a week for several months, with the strength of the chemical gradually increased over time. Topical immunotherapy is generally considered to be a safe and effective treatment for alopecia areata, but it may not work for everyone. In addition, some people may experience side effects such as itching, redness, and swelling at the application site. Hair transplant surgery. This involves taking hair follicles from areas of the scalp with healthy hair growth and transplanting them to areas of the scalp with hair loss. Wigs or hair pieces, these can be used to cover up areas of hair loss and provide a natural-looking alternative to hair restoration surgery. Lifestyle changes, making changes to your diet and exercise habits can help improve the overall health of your hair and prevent further hair loss. Counseling, in cases of trichotillomania, counseling or therapy may be recommended to help patients manage their compulsive hair pulling behavior. Treatment for alopecia depends on the underlying cause and the type of hair loss. In some cases, the hair may grow back on its own without any treatment. In other cases, treatment may be necessary to stimulate hair growth or prevent further hair loss. While alopecia can be a distressing condition, there are many treatment options available to help patients manage their symptoms and improve the appearance of their hair. With the help of a qualified healthcare provider, patients can find a treatment suitable to them.